Good afternoon, everyone, and greetings from sunny Phoenix, Arizona. My name is Nicole Pennick, and I'm the manager of Patient and Family Centered Education at Phoenix Children's. Thank you for taking the time to visit with us today. Over the next 90 minutes, I will introduce you to the team of highly skilled, talented presenters and share insights about Phoenix Children's. Then you will learn more about health literacy in the pediatric setting. We will tell you about the Emily Center Library and its evolution, along with our homegrown patient education portal. We will give you great insight about the request for information process and the health information nurse specialist role. And we will also share about the development of branded patient education resources and the Phoenix Children's award-winning Journey Board mobile app Journey Board and mobile app, along with the health education nurse specialist role. We will leave time for questions and answers, so please add your questions to the chat throughout the presentation, and we will collect the questions and present them to the team at the end. Today's presenters include a team with over 100 years of combined experience in healthcare. Starting with myself, as manager of patient and family-centered education at Phoenix Children's, I oversee the Emily Center and the One Darn Cool School program. I have a combined 20 years of experience in healthcare, patient education, health promotion, policy, and advocacy, having worked both in the community and hospital healthcare setting in the United States, Canada, and the Middle East. Before joining Phoenix Children's last fall, I was the manager of patient education for Sidra Medicine, the first women and pediatric specialty hospital in Doha, Qatar. I'm a certified health education specialist who considers herself a change agent because of my ability to identify patient family needs, dedication to service, and advocacy for others. Joining us today is also Jill Hecker Fernandez, who is a pediatric nurse of 32 years with both national and international experience. She has a bachelor's of nursing, a master's of nursing, and a doctorate of nursing practice. Her experience in nursing includes neonatal intensive care, pediatric intensive care, air-ground transport, open heart newborn, burns, trauma, and transplant. In addition, Jill has 19 years of experience in academia as a clinical assistant professor of nursing and is passionate about nursing at all levels. She is a health information nurse specialist in the Emily Center who is certified as a consumer health information specialist level 2 and a health literacy specialist. Brianna Scott began her practice as a registered nurse at Phoenix Children's Hospital in 2002. She's provided bedside care in the pediatric setting and cardiovascular intensive care units for 13 years. She holds a BSN and a certification in critical care nursing and lactation counseling. Brianna began her work at the Emily Center in 2002 as a health information nurse and obtained certifications in pediatric nursing and as a health information specialist. She manages the patient education portal, a repository for staff to access reputable patient education and health information resources across the organization enterprise. She also oversees the children's book collection and the relaxation room and amenities. Joy McLeod is a dedicated nurse with over 30 years of experience as a staff nurse, a hospitalist, and for the last decade, a health information nurse specialist. Joy specializes in consumer health information, Joy specializes as a consumer health information nurse specialist at the Emily Center, where she researches and vets evidence-based, reliable literature on health topics to offer families, consumers, and providers. She's passionate about serving families within the community and creating information packets at health literacy level that is meaningful to families. Nikki Mitchell, last but never least, is a health education specialist in the Emily Center. Nikki creates branded patient education materials with an emphasis on editing for health literacy and readability. Nikki has worked as a registered nurse in a variety of positions at Phoenix Children's and is a certified pediatric nurse and an international board certified lactation consultant. She currently works both positions as a lactation consultant and a health education specialist at Phoenix Children's. Nikki will present on the development of branded patient education material with a pediatric focus on health literacy patient education resources for caregivers and will highlight our Journey Board and Journey Board mobile app. Just a little bit about Phoenix Children's. Phoenix Children's is truly a unique place. We started as a 2-floor hospital within the Good Samaritan Hospital in downtown Phoenix, Arizona, and grew into a freestanding pediatric hospital in 1983. Recently, we've undergone a rebranding. Formerly Phoenix Children's Hospital, we are now just Phoenix Children's. The change comes as we continue to grow and expand over our health system. We are opening new hospitals, outpatient clinics, urgent care centers, and pediatric emergency departments in a partnership with other hospitals across Arizona. With a medical staff of nearly 1,000 specialists, Phoenix Children's is one of the largest pediatric health systems in the country. and most comprehensive children's care facility in the state of Arizona. We provide inpatient, outpatient, trauma, and emergency care services across 75 subspecialties. Phoenix Children's is the only freestanding pediatric specialty hospital in Arizona, serving a very diverse population who come from across the state. That includes pediatric patients from our surrounding First Nation reservations. We also receive patients not only from Arizona, but from surrounding states like California, Nevada, New Mexico, Utah, and Texas. The nearest freestanding pediatric specialty hospital is San Diego Children's, which is over 350 miles away. Phoenix Children's is a level 1 pediatric trauma center and is the only level 1 pediatric center in the state of Arizona.
So what is health literacy in the pediatric setting? If you can take a look at this slide. So health literacy, we know in pediatrics, we deal with the patient and the family as a unit. And so in this case, I think about it in reference to family-centered care, which is the core value of the mission and vision of Phoenix Children's and the Emily Center. And the core concepts that come out from family-centered care include dignity and respect, information sharing, participation, and collaboration. And these concepts intertwine very well with the goals of health literacy and patient care. Now, we all have knowledge of health literacy, that's why we're here today, but it's necessary to articulate a little bit differently for some of us about how health literacy is utilized, applied, and integrated into all of our individual patient populations. And the goal of that, of course, is to facilitate the best outcomes for that patient population that we work with. In the case of pediatrics, if we don't take the time to make sure that the parent understands instructions, when we have a parent who has lower health literacy or the health literacy is limited, it can be very disastrous for the child with very poor outcomes. When we think about research, there are research findings that show, well, put it this way, research findings in relation to children and adolescents and health literacy is very limited. Especially for those who try to manage their own care. It's not as robust as the health research that's been done in adults. They face similar health literacy situations and issues. But the other piece to that is that children are then also, it's coupled with their developmental levels and developmental outcomes. So those are all things that would have to be considered. Next slide, please. Here's a visual diagram of the key elements that require consideration to facilitate positive pediatric outcomes. And so when we think about health issues, it can be acute, it can be chronic, it can be new, it can be ongoing. But we look at this schematic and you can see how the influences begin with the healthcare system itself and the external environment. So the delivery system, is the hospital, can you navigate through the hospital? Can you navigate the system? Patient education. Are the materials complex? Are they easy to understand? The staff communication skills, are the staff able to teach? Are they able to use teach back and show back in order to facilitate positive outcomes? And then you also have the external environment, which is where people live 100% of the time. So what is the educational system, community systems? What support do they have outside of the hospital system that they're coming to get to find healthcare? Now, the predisposing characteristics, we have to think about it again. The family is a unit. So you have the parent and the child. And then you put into consideration their health literacy skills. So if you think about the child, we think about age, but in children, we also think very clearly about developmental levels. And developmental levels vary as far as how, when children are going to be able to understand and care for themselves. So we think about teenagers who are transitioning to adult care. We think about children who are learning to care for themselves as they go to school when the parent isn't right next to them. When we think about adults, we know that 77 million adults, 35% of the adult population have low health literacy. This number also includes the 28% of the parents in the United States, which is over 21 million people who have low health literacy. So we know with parents, there is an additional issue that has to be considered. If we think of an example related to this, we can think of the increase in emergency department visits that occur. And when we look at parents and families that have this issue occurring, 70% of those parents have a lack of healthcare access. And we know, just knowing that this is the only standalone pediatric hospital, that makes one issue. We're talking about very complex illness. Much of that lack of healthcare access is due to poverty, language, educational status, And one of the number one things, which some of the other presentations alluded to, is misinterpretation of illness severity and utilizing the emergency department as their center for primary care. So if we're looking at this diagram and we think about one particular very common diagnosis in children, which is asthma, let's look at the health literacy informed interventions, which you can see in the last two boxes there on the diagram. So if we think about knowledge in relation to asthma, we're going to think about decreased general asthma knowledge, decreased knowledge of the asthma treatment regimen, decreased knowledge of asthma triggers. And then in turn, there's going to be a decreased confidence in the ability to manage their asthma. If we think about the behavior piece, which is part of that box as well, we're going to think about there's increased exposure to secondhand smoke in many households. There's a decreased likelihood of many of these children to be seen by an asthma specialist due to access and availability. There's also usually a decreased ability to use an asthma action plan, determine the asthma zone, determine proper management. And there's also an increased perceived need for asthma medication. This is then in turn going to affect those child health outcomes. So we're going to have decreased asthma control, increased school days missed, which in turn probably means increased work days missed for the parents, increase in emergency department visits, increased hospitalizations in children with asthma, and decreased rates of child school and attendance overall. So when we think about childhood health outcomes, and I was asking a question in another presentation about this. So we know we use Teach Back, and Teach Back is a very familiar process. In children, one more process with parents and children that's beneficial is called Show Back. So there was a study that looked at 70% of parents with low health literacy, and they were able to use Teach Back for medication instructions, but when they further assessed, only half of those parents, 35%, demonstrated understanding through Show Back. And so when we think about asthma Show Back, as that's the illness that we were talking about through this diagram, another study showed that when providers asked children to show them how to use an inhaler, the child was more likely to have a higher percentage of inhaler steps performed correctly 1 month later. So we know that Show Back is a very valuable tool when we're talking about pediatrics and health literacy. Now, as we continue to tell you about the Emily Center, our mission and vision will coincide with the overarching goal of health literacy for patients and families. And so I'm going to step back and let Brianna take over.
Thank you, Jill. My name is Brianna Scott, and I'm one of the health information nurses. I'd like to share with you a story of the Emily Center so you can understand how we began. It was with two very different stories that came together for a common purpose. A little girl named Emily, here on the right, was diagnosed with a rare and aggressive form of leukemia at the age of 3. And her parents fought long and hard for her at the bedside, but they struggled to find health information to help them learn about her diagnosis and treatment options in a language that they could understand. They were torn between taking time away from her to research and call around the country to learn more and make decisions about her care, and spending time with her at the bedside. Unfortunately, she lost her battle just before her 7th birthday, but the Anderson family was determined to advocate for the other families in the hospital that still needed a place to go for health information in a language that they could understand. If you go to the next slide, at the same time, we had a pediatric nurse here at Phoenix Children's, Kathy Warner, who was working on her doctorate. And in her research, she was interviewing mothers of babies who had died from SIDS. And she learned from those mothers that many of them had recreational drug use while breastfeeding. And all of those mothers had said that they would have made a different choice if they had had more information. But none of them felt like they had a safe place to go where they could ask hard questions and get reliable answers. We go to the next slide. So Kathy Warner and the Anderson family came to Phoenix Children's with the same request. And with a lot of hard work and fundraising, the Emily Center was born into the Brill building on Good Samaritan Hospital campus. This first picture in this slide shows the small office We were affiliated with Phoenix Public Library, which allowed us to have a public library status and open up our services to all of Arizona families instead of just Phoenix Children's patients. We started out with a librarian who very quickly within the first few months said, this is a job for someone who knows medical terminology, who knows pediatric illnesses, and who's comfortable supporting a family who's just been given a difficult diagnosis. And so we've been staffed with registered nurses ever since. But if you can imagine a world, for some will be harder than others, without the internet, without email, and consumer health was very much in its infancy. There was limited resources in the general population, and pediatric content was almost non-existent. And so it was clear that we needed to develop a team that could work with the providers at Phoenix Children's to write the content that was needed for our families. And so our team grew, and our resources grew, our collection grew, and our hospital grew. And on the right-hand side, you'll see we moved into a freestanding hospital in 2002 and grew our book collection to over 1,000 books for adults and kids in English and Spanish. And we fast forward to the next slide, continued to grow, and this is our current space now. Just before the world shut down with the pandemic in 2020, our walls were knocked down and we had a major renovation. And you can tell we moved all of our books out to Phoenix Public Library to expand our reach into the community and to open up our space to provide a more healing environment for families to come, incorporate wellness and resilience into our space. Yeah, next slide. So the one thing that has remained constant is our mission and vision. Our vision is that information offers hope, and our mission is to provide personalized health information, patient education, and support and guidance for families with family-centered care. Since we opened in 1990, we've served over 1 million families. We've developed over 2,000 Phoenix Children's branded education materials, and we have supported the cultural community of by having our bilingual staff members who speak English and Spanish at the front desk when people come in. Next slide. You can see here in our space, we have a room on that left-hand side that's a relaxation room. We call it Quiet Your Mind. It has the massage chairs are the hit, but they have guided meditation apps on our Apple TV and our iPads. VR goggles are available to just escape and get away. They can close the door and have a private place just for a moment without leaving the hospital. Refresh and kind of regroup to go back to the bedside. We have a phone charging station as they walk in. There's a business center in the middle there with computers and printers, fax machines, copy machine, and a notary public, and all of our services are free. You can see down at the bottom, just barely, it looks like our children's collection we kept. We didn't send that out to Phoenix Public, but there's a kids cove with iPads and apps for them as well. Go to the next slide. And so our physical space evolved, so did our resources. We went from having a back room full of file cabinets and paper resources to changing to digital resources and digital files. And we really needed a way for staff to be able to access all of the resources that we have available to them in a one location. So we needed a repository for all those resources. And we developed what we call our patient education portal. Next slide. In this portal is a one-stop shop for all of the different types of resources that we offer. So we have health information, we have patient education, and we have resources that the hospital has access to as an organization that might be tucked inside of other programs. So we've used this portal to tap into each of those. It's accessible to the staff through the electronic health records, and then they can also get to it through our intranet. So this expands our reach in our organization, not just to the inpatient staff, but our outpatient clinics, and now as we're growing into satellite areas all over the valley and all over the state. They can all tap into this and have quick access to print. If you go to the next slide, it'll show you an example of the patient education portal. So this is the layout. We have pages built out for all of the subspecialties on that left-hand side. And then on each page, it's formatted with different categories of boxes. And we populate those boxes with content related to the subspecialty under that category. So a lot of that you can see is our branded content, but then there's links to other resources that we may not necessarily need branded content for, but we know there's resources available. And these can be resources that are available to the public that have been vetted by our nurses here. And then if you look up at the top, the red bar has the links to other portfolios. So within the organization, an example would be the pharmacy needs to use a program called LexiComp and Micromedics just for their daily operations. But tucked inside of those, there's a portfolio for patient education for pediatric medication handouts. There's another one in Care Notes that has patient education in general and clinical skills. So these are direct links to the patient education part of those services and those platforms. So they can click right into there and search. They have a favorites page on there as well that allows them to customize the content that they want to access. So they can get a direct line to the content that they use the most if they're in a hurry and not even wanting to search. And then we have a what's new where we can keep them updated on the new handouts that have been created, any updates that have happened, and then anything that may have been retired, just communication to keep them up to speed with what we've been doing. And then they can search on that top right search bar as well. So they have multiple ways to find what they need. And there's a banner that you can't see because it would have made my screenshot too small, but a banner for communication in real time of differences in the access that we have to content. All right, Nicole, if you want to go to the next slide. Our next slide is the traveling book cart program. This is a favorite program. It's supported by the community and our volunteers primarily, but it comes out of the Emily Center. The community donates new books, just fun leisure books for kids of all ages, and it travels around the hospital by our volunteers on this book cart. They go to all of our inpatient floors, our surgery waiting areas, and our clinic waiting areas. And it encourages kids to read, and it also encourages our parents to read with our kids while they're at the bedside. And one of the areas that's interesting is our NICU really uses these books quite a bit, and that really encourages that parent-child bonding where they're reading to them, and the kids can get familiar with their voice and their presence. And it helps with bonding in a time where they can't always hold them in the normal ways of bonding. We are also a hub for all donations for books that are donated to children's hospitals. So we coordinate those donations, and then we act to distribute as a hub for ordering content for the different care areas. Next slide. This is our children's collection, a little bit better picture. It has 78 topics, primarily health related, in English and Spanish were available, and it's anywhere from autism and ADHD, cancer, epilepsy, to family life and integrative medicine. Really tried to add some more mindfulness and emotional intelligence in there. And these books are available for checkout. If you can go to the next slide. The approach with these is for kids of all ages, but also audiences. So sometimes we need information for kids to understand what's happening to them and what's happening or what's happening to their sibling, to other family members, or even to classmates if something's happening in the classroom that they need to understand. So we'll get school teachers that'll also reach out when a child comes back to the classroom. We approach it very much the same as health information for our families, where we do a basic foundation of understanding how the body normally works so they can take care of themselves, but also understand when things aren't going right. They also have this Maddie Breathes is about a little boy with Down syndrome and a tracheostomy. So chronic illness in the home and what to expect for care, but also just to normalize that there's still going to be regular sibling interaction and what that looks like. Next slide. This helps the kids that are dealing with asthma and a lot of times sick and scared, where their chest gets tight and they don't understand what's happening. But this shows them a little girl who also can speak to what's happening in her body when those lungs constrict and she can't take a breath, and how she works through that. Next slide. It can help them understand how to interact and cope when things are going on in the family. And so like this child with a grandparent with Parkinson's, and how do I interact with them? What do I expect? And how to navigate that new situation for the family. Or a child who's excited for a sibling to come home only to find out that something's happened and there's been a loss. Next slide. We like to have content that they can relate to someone who has a diagnosis that they have or that's in their family. And Temple Grandin's got a great story of her overcoming adversity and having autism and still being able to contribute so much to the community, and really embracing her strengths of recognizing patterns and her unique sensory experiences that help to really change and provide humane treatment in the cattle industry. Next slide. There's books to help them understand if they have cancer and they're losing their hair, or a friend or a family, if mom has cancer. Next slide. And then there's so much information out there about emotional intelligence and mindfulness and how this helps kids be resilient. And so we have integrated books like Breathe Like Bear, which is guided mindfulness activities for younger kids, and Color Monster is a great emotional, it helps them with emotional intelligence of processing emotions using colors. Next slide. We have Spanish books and books in Braille. Next slide. Books to help them understand how to say things like cystic fibrosis is so hard, but 65 Roses is a little more relatable and easy to practice. Kids with ADHD and the wiggle fidgets, kids with anxiety and needing tools in their hands to deal with the anxiety in the moment. Next slide. And then just connecting with differences in physical and intellectual differences with wandering eye or dyslexia, or this younger brother thinking his older brother is awesome with his a limb difference, and how that doesn't stop him from being an awesome brother. Next slide. We try to incorporate some mindfulness into our space, and so we have a Zenimal, which is audio guided mindfulness activities, and the Color Monster book I mentioned earlier was actually donated to us from a community organization using it for the emotional processing with colors, and they created quite a few activities to go alongside, intended to be done with a clinical provider or a family member or a teacher. And these have really been embraced and used by our child life specialists and our ACEs program, which is a program for children with adverse childhood events. And then a pediatrician from our Center of Resilience and Wellness have really taken to these and incorporated them into their practice. And we have a request out for funding for these aromatherapy sticks, to have individualized sticks to enhance their experience and the benefits of essential oils. Next slide. And last but not least, we have a Beads of Courage program that the Emily Center has become ambassadors for. We love that the kids get to capture their journey through the art of beads. They get a report card of all the things that they've been through on their journey in the hospital. And they get to capture and exchange those experiences for a bead that they can use in their own unique way to tell their story and their journey. And when they come to the Emily Center and we get to be a dispensary for those beads, they get a chance to tell their story to us and to others in a unique way. Thank you.
Thank you, Brianna. Thank you all for being here today. My name is Joy McLeod, and I'm one of the health information nurse specialists. I'm going to talk to you today about the role we have in providing health information. The Emily Center strives for excellence and professionalism when we provide services to the community, to our patients, to anyone that asks us for information or anyone we encounter. We serve all of Arizona. We serve inpatients, outpatients, our community, our schools, our consumers out there, or our hospital-based families. So we serve patients, caregivers, providers. We haven't said no to anybody. So it's nice to be able to offer that specialized health information at a specialty level, and it's information that providers and families in the community know that they can trust. They can get information on different disease processes, different conditions, as well as wellness topics or anticipatory guidance information. We use reliable resources to validate the currency, the relevancy, the authorship, and the purpose. These screening tools ensure that the information we provide is reliable, it's current, trustworthy, evidence-based, and most of all, it's useful. It's not useful for a family to get a research article that they can't read or understand. So we always sit with them and we interview with them and we talk about what their individual needs are or their personalized needs are for these requests that come into us, because we never assume what the information is what we think it is. We have to ask the question. If we're not asking the right question, they're not going to get the right information. So part of what we do is an assessment with families when we have an opportunity to sit with them and evaluate what their needs are. Sometimes they come in with a piece of paper of a diagnosis they can't even pronounce and they're asking for help. So some of it's very basic. They want to just know what the basic diagnosis is. Others want to know information that's much more complicated and information they can use to help make decisions on their child's health care. So in addition to consulting with the family, we also consult with a medical team when it's appropriate, and we also have a confidential review of the medical chart. This helps us guide the information that we offer to them, so we're making sure that we meet their individual needs. Because there is such a diverse intensity level of the information that families like to receive, anywhere from consumer information to high-level complex reading information, research articles, or in some cases, clinical trials, we always want to make sure we're asking the questions about the information that we're providing and at what level of information they need it returned to. Next slide, please. Goal of the health information nurse specialist. Well, we focus on, again, health information and wellness information for children. We promote overall wellness by providing an environment that supports the body, mind, and spirit, as Brianna so eloquently put, through our relaxation equipment, mindfulness exercises, and health information resources. We hope to build child and family resilience. Next slide, please. Scope of our services. As I said before, we must be asking the right questions so we make sure they get the right information. We will sit with them and talk with them about exactly what they need. Is this information on a diagnosis, treatment, outcome, future care? So all of these questions are part of our assessment process when we identify what the needs are. These are the questions we're asking. We also ask about the information at what level they want it. We talk about easy to read information, or we talk about more complex journal articles. And that helps guide our research for the families. Next slide, please. When we do RFIs, we call them requests for information. It's guided by our mission and vision, which also aligns with the mission and vision of Phoenix Children's. We believe that everything we provide offers hope. We like to personalize the information to make it be supportive and guiding and a good guidance for families. We recognize specifically that there's a direct correlation between health literacy and health outcomes. So we are committed to using resources that are easy to read, accessible, and that are current and relevant as we individualize the requests we receive. We can provide this information using different platforms, such as digitally for the digitally health literate, or we can also provide physical copies for those that are more comfortable with hard copies. Next slide, thank you. The assessment process will also determine the patient's needs or the patron's needs or whoever's here asking us for information. We like to have that questionnaire. Who's asking the question? So is the parent asking the question for the parent? Is the parent asking the question for the patient to better understand the diagnosis? Or is this for a grandparent? Or is this for maybe the primary care provider that somebody's asking for at that level? So we never assume. So we always ask the questions and we determine, how much information they need and in what language and what style, because everyone has their own learning style. I love the fact that we have a children's section and we have a learning studio, which I'll tell you about shortly. But within these studios, we have information at a level for children to understand too. So I know that our guest speaker, Brianna, talked about asthma. We have interactive programs where the child can pull up an animated video and learn about the asthma process within their body, the coughing and how the areoles, what happens with the airway system, and when it gets relieved with medication that they provide and they learn how to provide for themselves, and how that affects their body. So they learn to be the experts in understanding what's happening in their body so they take better care of themselves. It's very important to catch them at all element styles of learning, not only reading, if it's a digital, if it's a hard book copy, but the physical aspect of it. And the animated technology that we have is state of the art, and it's very helpful to bring that lesson home to the families. Assessing the health literacy level, we use clear communication to do that. And we also talked about earlier about the basic research articles versus clinical trials versus just consumer health information, which is, a large percentage of what we provide, but just so you know that we have the capability of getting all levels of information for the family. And we have colored copies and videos and different platforms that we can provide that from. And it's lovely to have our patient education portal so the staff can have it accessible at their fingertips. And if they can't find it, or if they're too busy or they need additional information, they can always call the Emily Center and we're here for them. So that's important for them to know. Next slide, please. Our learning studio. Well, this is the state of the art, and it's a very useful resource for our Emily Center. It's a studio room, really. It's a learning studio where we have several resources available to providers, to anybody that really wants to use it for learning capacity. It can be used for private consultation room. We have resources in there for providers to pull up to explain diagnosis to families. And one of these resources we use is a visible body. It's a comprehensive collection of databases. It's comprised of 3D virtual anatomy models and videos with engaging touchscreen interactions. So imagine the 3D heart. So your physician is in the room, your provider's in there explaining to you what happened in the surgery today. You're sitting at the table. He pulls up on our beautiful Microsoft Hub screen that he can split into two pieces. He can pull up the normal anatomy of a heart, and he can pull up on the right side your child's picture, because he has that capability to pull that up on the screen and turn the heart in a 3D dimension, if you're visualizing with me, and take a look at that valve or whatever repair he made. He can annotate it. We can print it out in a colored copy for the family to have that and take with them, so they can better understand the process of what happened during the surgery. Or say a consultation room is used for pediatric surgeon who has a surgery coming up for this patient. I've seen them come in, they bring the apparatus that they're going to apply to the child to get the child familiar with the territory they're going to be involved with the surgery, post-op care, what to expect before, during, and after. It's a great resource for individuals to use to teach the family, and it's very engaging. We have other programs with visible bodies, such as Human Anatomy and Atlas Animations, Muscle Premium, Anatomy and Physiology, and Circulatory Premium. So we're very proud to offer those to our families and to our providers. The Microsoft Hubs that we have can be used for displaying educational materials, as well as providing information up on the board, like I explained, with the consultations with the providers, or we can have meetings using them to display information. So we're very proud of that learning studio, and it's highly used. So next slide, please. So this information talks about packets. and why we created packets. And packets of information are just a collection of information that we would normally provide if somebody asks us for that, only it has a little bit more dense information in it with a lot of tabs that talk about the different sections in there, and we'll go over that as I explain what the health information packets are. But first of all, I'd like to talk about why we created the health information packets. And the main reason is because our information was being asked for so frequently, it was just easier to put them in packets and keep them updated regularly, so they're current. But we work with inpatient and outpatient clinics to have these packets available, so when the patients come into the clinics, they can go over them and understand the care that's being provided. And it also acts as a nice foundation for them to have available, so there can be a nice dialogue back and forth between the provider and the family member or the caregiver or the patient themselves, as far as asking questions about what they can expect with their health care and anticipatory guidance and future care and things like that. So it's very important. We also support our community outreach programs that we have. We have Cruise and Health Mobile and the Breath Mobile that utilize our resources. And we also offer packets to support for accreditation and inpatient rehab, and that's very important. I heard a lecture earlier talking about accreditations, and so this is one resource that we have available for them to have in their clinics for their patients as well. We work extensively with hospital-wide clinical experts on these packets to make sure that the packet has information that they need for their patients. So it's not useful, right? If we're not asking and supplying the right information, then it's not useful information. So we often update it every 2 years to make sure it's with the current guidelines and standards of care, or sooner if they change before then. These resources are available to families all over Arizona, in the community, inpatient and outpatient, and in the hospital. They are all evidence-based, and they are built to meet the needs of our patients and families, and organized with individual tabs for easy reference. So in the references we'll start with the overview of the diagnosis, and then we'll go to treatment and interventions, and every packet might be a little different depending on the diagnosis. We work a lot with our genetics clinic, who has a lot of specialty packets related to very rare diagnosis, you can imagine. So it's nice to have that information at the fingertip. And then we always make sure that there are resources and support information and education information in there for families, especially information for those that have complex medical needs. We always include 504 and IEP and special education information for them to have resources available and the roadmap to follow. So it can be overwhelming out there if they go out searching on Google themselves. So we like to have them come back to us, or start with us originally, to make sure they're getting evidence-based information that's useful to them. So that's the end of my presentation. Nikki is going to talk to you now about branded patient education resources and the health education nurse specialists. Thank you all for joining me today.
Thank you, Joy. So my name is Nikki. I'm one of the health education specialists from the Emily Center. And so what is the role of the health education specialist? It's really just to we develop and maintain our branded patient education materials. Right now we have about 1,500 handouts in our portfolio. They are all in English and in Spanish. And we also have some handouts that are in other languages, including Arabic, Burmese, Swahili, Vietnamese, Romanian. So we kind of have a broad language portfolio too. We've also created and maintained 22 journey boards and mobile apps. We work with the clinicians and key stakeholders to create and maintain our electronic education records and the flow sheets, and they really mirror our journey board platform. And I'll explain more of that and concept in a few other slides, but just wanted to introduce it. We are also responsible to teaching our new clinical employees, such as nurses, new providers, and resident orientations. Next slide. So what is health literacy? I mean, obviously, we've talked a lot about it during this presentation, and I'm sure you've heard it in many other presentations, but really the reason why we wanted to talk about it with you is just that at Phoenix Children's, we follow the CDC's definition of health literacy, and it just really is a degree which individuals have the capacity to obtain, process, and understand basic health information. And this is really important for them to make appropriate health decisions. And for our population, you know, we know that 90% of adults do not have proficient health literacy skills, and which can mean that they aren't able to care for their child safely if they do not receive proper education. And so one of my favorite facts is actually listed on here from HRQ. I'm sure you've read it already as well. But I like to share an example that this actually happened to me. I took my daughter to our dermatology clinic for her eczema. And, you know, I'm listening to them and they're explaining everything to me and showed me 2 different creams to use. And I went and picked him up at the pharmacy and got home, and I'm like, oh goodness, is the purple one for her severe or is it for mild? And I could not remember. And so I think sometimes as, you know, I really encourage healthcare providers to put themselves in that parent's shoe when they're teaching. And we really don't know what else is going on at home. And so they may be very stressed because, you know, they're in the hospital with a sick child. They have a lot to know and learn about their child's diagnosis, but they're also thinking about other outside components such as, you know, their work, their other children, who's going to pick up their child from school, who's going to feed the dog at night. And so I think we have to think about these parents that are trying to learn new skills and really put ourselves in their shoes to make sure that when we teach them, that we're teaching them in a way that they can remember correctly once they get home. So next slide. So readability is something we really focus on when we're creating our handouts. Any materials that we give to families should be easy to read, to follow, to understand the very first time they read it. It should be clear, concise, and organized. Next slide. So we focus on, you know, plain language, and some simple strategies is just to use short words and short sentences, short paragraphs. Our aim is for 8th grade reading level or less. When we develop our branded education handouts, we follow the strategies set forth by HCEA. We're part of this national organization, and we worked on developing the guidelines for writing in plain language. And we really try to go for 8th grade, but we sometimes can get it down to 6th grade, which is even better. Avoiding passive voice and really focusing on what they need to know to care for their child safely at home. Next slide. So for some goals for health literacy and readability is really helping families navigate the healthcare system, and then also teaching the patients how to do this too. You know, one area of focus of late is transition to adult care. So since we are a pediatric focused hospital, we also want to make sure that we're educating our patients how to care for themselves, you know, as they transition to adulthood. And so we needed to teach both the caregivers and also the patients in a developmentally appropriate manner. For example, you know, if a child is diagnosed with type 1 diabetes, we need to make sure that the patient knows how to care for themselves safely as well, such as teaching them how to test their own blood sugar. And then as they get older, we need to make sure that they know how to make their own doctor's appointments, how to refill their prescriptions, etc. So our main focus is on patient and family-centered care. We do follow health literacy standards from AHRQ as well. Next slide. So for plain language, in the pediatric setting, it's very important for families to know how to care for the child safely once discharged home. We need to make sure they understand their child's medications, any care instructions and treatment plans, who to follow up with, and who to call with questions. We know those with low health literacy have higher rates of visiting the emergency department. They have more hospital stays and have higher levels of medication errors. So it's really critical that we focus on plain language when educating our families, and then making sure that they understand, you know, what we're teaching them and following up with them. Next slide. So plain language writing examples up here. This actually came from a handout requested by our cardiology team. And as you can see, the before example is very difficult to follow. I mean, what is it even really saying? So when we edited it for readability, we really focused writing in plain language, made it more simple and easy to follow, and made it more direct. Our goal is for families to understand what they are reading when they read it for the very first time. Next slide. And so teach-back method, it's integrated into all of our branded patient education content. And it's just a way of checking understanding. And so it's very simple to incorporate in your teaching, and it's using those tell me, show me statements. Jill mentioned them before as well. If you want to go to the next slide, the 4 critical elements of teach-back, I'm sure everybody's familiar with this. Assessing what the learner already knows, teaching them, evaluating their understanding with teach-back, and then filling any gaps of learning. So if we realize when they teach us back that there's some parts that need to be retaught, you can take the onus back on yourself and just say, I think I was a little unclear when we were talking about your child's medicines. Here, let's go back and start from the beginning. And so I think when you kind of take that onus back on yourself, it makes it a little bit easier, and it makes it a little bit less stressed for the parent as well. So next slide. So as I mentioned, it's standard part of all of our in-house created content. And so you'll see these tell me, show me statements at the end of our handouts. And also the reason why we do this is it really makes it easy to know what are the high, critical points that families need to know for safe discharge. And then, if there are skills that they need to show, then we can actually see them, how they will give the medicine, how they're going to use their inhaler, how they're going to check their blood sugar levels, so it's really important to do these teach back points with them, and so that we can figure out what they know and how we can help them if there's any gaps in that learning. So next slide, please. So what are our journey boards and mobile apps? So as I mentioned earlier, we have 22 journey boards and free mobile apps. The journey board concept came from a team of diabetes nurses who are looking to educate their families in a simple but easy to follow manner. And so since the beginning, we've now created these 22 journey boards. They break down what families need to know into simple chunks of information, and with a focus on teach back. So you can see that these are all teach back statements, the tell me, show me statements. And then the game board concept really engages the families and the patients. The boxes don't go in any specific order. So when we do our teaching, we can jump around, and it's pretty simple to do that. And it really just focuses on what the families need to know to safely care at home. And it also puts some of that learning back on the families, so they can ask staff about certain boxes if they haven't been taught them. And it really also allows for staff to let the family know the plan of education, because if this is like a child with a new trach, they probably don't know what they need to know, if that makes sense. So by showing them in simple little steps, it can break it down easier for them, and it's a plan for them to follow. And so then, they can talk about to the families, the staff can say, today we're going to go over your child's home medical equipment and supplies. Or, if a family's like, hey, you know what, I know we're going home, but nobody's talked to me about when my child can return to school. So it really opens that conversation between a staff and the family members. And then it's just easy for them to follow. So the journey boards that we have include sickle cell disease, diabetes. We did one with a ketogenic diet therapy for seizure control, which has gone amazingly well. We have one for central lines for home use, like I mentioned, tracheostomy. And then we have some for the doctors, we have one for doctors' offices. So it's not just focused for inpatient, but any patient that is in the hospital should have a journey board in their room that helps them throughout their hospital stay. And then our electronic education records mirror the journey boards exactly. And so what's nice is it's a really fluid system from start to finish. So breaking down those chunks of information and then be able to document in the education record exactly what you teach the families. And so they're the same boxes, the teach back points, it's very fluid and it's very easy to document. And then our mobile apps, we have the 22 journey board mobile apps that are free. They're available for all Apple and Android products. And we give families instructions how to download these mobile apps. And what's so awesome is that they toggle between English and Spanish. And we've just had really great feedback from families. We know that, you know, some families love paper, but we also know that everybody has their mobile device, right? So I guarantee next to you, everybody's gonna have their phone, right? So we know that if you have families, you know, be able to have that education right at their fingertips, it's pretty awesome. And so I'm gonna go through some mobile apps for you just so you can kind of see what we have.
Let me know when you're ready, Nikki.
I'm already doing it. Well, now it's thinking. All right. So this is our journey with diabetes. So again, it's that kind of game board concept with the different boxes. And what's awesome is that when you're going through these with families, their teach back points are right there for you. And if you click on the resources tab, you can go into our handouts. And so what's nice is that these are available again on the mobile apps. They're also perfect for families that just want them on their phone, or if they want them in paper copies, we can give it to them, and they're going to receive the same information whether it's on paper or the mobile apps. It talks about the different types of diabetes on here, and then the teach back points. The nice thing about our mobile apps is we have notes section, so they can type notes in there and save it for later. And then we also have this little star on the top left corner. And so when you click the star, when you go back to the journey board, you'll see that at the bottom, it shows that we've gone through that with the families, we've done our teach back, and we're done with that box or that square, which is pretty awesome. One of the other things that we did with the diabetes team is they had an app developer, an artist create some of their information on
this video explains the two
video.
types of insulin.
So,
Like a drippy faucet. But it can also release large amounts of insulin very quickly when it needs to, like turning a faucet on all the way. In type 1,
I just wanted to kind of show you a little bit of the videos. And so it's so nice because, again, it's integrated right into the mobile apps, and they can go and watch them whenever they want. They can go back and look at them in a month from now if they forget. And then it's nice too because if other family members, maybe they're in another state and they want to learn about what the child's going through, they can download these pretty easy and follow them. The other one I was just going to kind of show you is we have a journey board for central line for home use. We know that infection rates are very high with central lines at home, and so we created this journey board specifically for home use. You can kind of see it's set up the same way. And so like here are the teach back points, what infection is and what the signs are. And then the different resources. So we have them broken down to CDC, PIC, and PORT. So again, if the child has a PIC line, they can click on that, and it goes right into the different areas on the PIC line. So one of the other ones I was going to show you, again, teach back points, going into those resource tabs. And then we have sometimes you'll see some of the resources are different handouts that we have, not just specific to, like, say, central line, but like this one has the medical ID. And so this is a handout that we have that we give families in general, but then it's nice because it's right in the app too, so they can have access to that information right there. All right. I'm gonna stop sharing, Nicole, if you want to go back to the PowerPoint. So I just wanted to kind of go over the process of developing branded handouts. This is a very high level overview, but it really shows the flow of the development from start to finish. You know, each box has several steps to them kind of behind that, the little square, but it's really, you can just see it's a robust process. It has many different layers. We really focus on, when we create the handouts, that we're not just getting the input of, you know, let's say one physician from one group, specialty group. So during the expert review process, we make sure we have buy-in from all the providers. So let's say it's the tonsillectomy handout, and we have the whole entire ear, nose, and throat team look at this handout, agree to the content, so that we know that when we're teaching, that the families are going to get the same information from every single provider. So it's pretty awesome process. It's very robust, and we've had pretty good feedback on it. So. Next slide, please. And so the intake portal for requests, this is a automated process for all of our branded content requests. And it's really, the stakeholder submits a request for branded content here, and it's located on our intranet. And then the automated process is for creating a new handout, or if there's updates that needs to be done on existing handouts, they would go through the same process. And once they submit the request, then one of the health education specialists will reach out to them and submit a bookings consult request. And then if you go to the next slide, Nicole, this is what the patient education intake portal looks like. It's very structured, but very simple, just a few questions. And then there's drop-down menu options as well. And so they'll fill those out. And then next slide, please. Once it gets there, then we'll send them a bookings link. So it allows them to self-schedule. And we set up specific days and times on our shared, like on a calendar, so they can pick up which one works best for them. And once they book it, it populates on our shared calendar. It makes it really easy to follow up with them. And then it allows for us to do better time management. So instead of just, having a bunch of different meetings on different days with stakeholders, we've decided to, offer 2 different days and specific times so that we can block our calendar. But of course, if those don't work for them, we're pretty flexible to try to meet their needs to get a meeting with them. And this also allows us to capture data on the back end, and again, better time management. Next slide. So we recently added a clinical leadership review to our content development, and it just adds a clinical layer to our process. And so really our criteria for developing branded content is if the content is not already available. We know that some content is a dime a dozen, so we're not going to create a handout, on chickenpox unless we do something different at PCH, which we don't. But we really want to make sure that we're going to develop it if it's not already available from another platform. And then if it supports a business need, or if it's aligned with a policy, procedure, or clinical guideline, or if the senior leadership approves the request, such as the development of pediatric focused COVID handouts. So we recently did those. I mean, there just wasn't a lot of information for pediatrics on COVID. And so we worked with our COVID command center and developed some very specific pediatric focused handouts on COVID. And so the CLR process is only done if it's necessary, I should say. So next slide. So I just wanted to wish everybody a happy Health Literacy Month. We are currently celebrating at Phoenix Children's with several different programs throughout the month. We have some banners around the hospital and outside the hospital, just to celebrate this very important month. And we hope that your hospital is celebrating too.
Great. Thank you, Nikki, and thank you to the team for presenting. It was very insightful. It's always insightful to me because I still consider myself a newbie here at Phoenix Children's. But I wanted to hand it over to Jill, who's going to facilitate questions and answers for us. Jill, if you'd unmute yourself.
Yep. So currently in our question box, we have a question from Kristen Laswell, and she's asking, how often do you review your materials and what does that process look like? Joy, maybe you want to address the packets, and then maybe Nikki, the the branded content.
Absolutely. So I'm constantly on RSS feeds for, American Academy of Pediatrics and some major reputable resources. And I'm always looking for updates and reading the information that's available. So as the new guidelines come out, I will update whatever's available to update in the packets that I've already created. And also, the information that we provide to families outside the packet information, just on a daily routine here at the hospital, just a request for information. We make sure that the repository where we keep those is also updated. So it's updated on a regular basis, if not more frequently than 2 years, at least every 2 years at this desk.
Nikki?
And then for branded content, our hospital policy is every 3 years for content review. And so then what we would do is whoever, the key stakeholders are for that content, we would reach out to them and say, this is ready for review, if you can look at it and your team, and then send us back any changes. But then we also, know that policy changes pretty frequently as well, and it might be sooner than that 3-year review. And so again, reaching out, if we're aware of the policy, we'll reach out to stakeholders. But a lot of times when there's a policy change, they'll reach out to us and say, hey, we've, changed the bathing for, central lines. It's now X, Y, and Z. And then we'll work with them to change the handouts to reflect this change in policy. So.
Thank you. Jill?
Okay, we don't currently have any more questions in the question and answer box, but I have a question for you, Nicole, which with all the access to digital and online sources, why would we want to have a paper book library in a hospital?
Sure, thanks for that. I think that's a very good question because, again, we think now with the evolution of technology, everything's online at our fingertips. But our presentation and all the presentations that we've seen throughout the day reiterate the fact that health literacy is low. So we know that misinformation and disinformation is abundant out there, and we want to make sure that we're providing timely, current, evidence-based, accurate information to patients and families. Also, when you're in the healthcare setting, there is also a decrease in cognitive ability, so cognitive overload, stress, and anxiety. And so having a centralized place where families can come and access information at their fingertips in a hospital is very necessary in today's time. And again, also with what we talked about, disparities in healthcare, not everybody has access to resources. Some families don't even have a laptop. Maybe there's still a one phone or limited data. So the fact that you can email the Emily Center, call the Emily Center, or talk to your healthcare provider and get access to information is still very relevant and necessary in today's time.
Thank you, Nicole. Still not any questions, but I have a couple more here. I think maybe Brianna, I'll direct this one to you or to Joy or to Nikki, whoever wants to respond first. But what are the areas of the hospital that utilize the Emily Center the most? Brianna?
We get inpatient and outpatient requests quite a bit. I would say that our genetics department is intentional about preparing for an upcoming appointment and placing orders to be ready to teach to the family when they arrive, as well as sending information home with them once the visit is over. I think they have a difficult time finding information that's written in a language that they can understand, and so they really have committed to using us pretty regularly.
Joy or Nikki, do you have a comment about that from your perspectives, from the types of work that you're doing in the Emily Center?
I would agree with that. We get regular requests on a daily basis for teach back information at the bedside. So the patient education handouts that are created are very useful and available for families.
Nikki, anything further?
I don't think so. I think they answered it well.
I think if you look at the numbers from our patient education portal, you'll see that the emergency department is really our highest user on that level. So they're not necessarily ordering information from us, but they have the most clicks as far as accessing their ED content, and the topics that are searched up the most are ED related, fever and fever medication handouts and things like that.
When you say order, can you just elaborate on what that means?
Yes, so the providers can place an order in the electronic health record in their chart for, just like they would order medication or a procedure, they can order health information from the Emily Center. We receive those orders and communicate with the staff on what level the family needs it and how much information they need, and then deliver that to the room and then document right in the chart what they've received.
Okay, we have another question from Allison Caballero. And she says, through your outreach to teach clinical staff about available resources, what have you learned in terms of what motivates them, the staff, to use the resources, even with patient acuity and staffing, even when with the patient acuity and staffing challenges that are present?
I can answer that one. So really, I think having a repository or a patient education portal with all of the handouts easily accessible has motivated them, because it makes it so easy to be able to go and print off what they need for their families. And then just having the fluid system of our education records, following handouts, following the journey board, following the teach back points, it makes it pretty simple and very fluid to be able to document that as well. With the patient acuity and staffing changes, I think, you know, our main goal is to teach those families how to safely care for their child at home. And I think at least in our facility and for pediatrics in general, the staff really focus on what does that mean to that family. And so I think just what motivates them is just the simplicity and the easiness of getting that information.
And if I could add to that, Nikki, that was well said. The easeability of just picking up the phone or putting in a request for information using an order form through our database, to have that information brought to them, as busy as they are. Sometimes they are too busy to click and download themselves, but it's nice to know that we can be available to help them in that respect and bring it right to the room for them.
What about providers that are not based in the hospital? How do we get information to our PCCN, which is our Phoenix Children's Care Network?
Many of them will email us or put in a request for information using the computer and let us know how they want that delivered, whether it's an email, whether it's a hard copy, digital form, something like that.
So good old-fashioned snail mail still works?
Well, you know, actually, they still love that. Yes.
So we have a comment here from Tom Blair, who is at the VA Portland Medical Center. And he says, our hospital does the same thing as the orders, but rather with consults, whereby the provider sends a request to the library staff to help find information not readily available, such as more rare diagnoses or information that is not available in other languages or common languages. So that's a very nice comment. So there are people out there doing similar things. And then we have just a little bit of time left, but I guess one other question, I'll direct this one to Nicole. Brianna talked about at the beginning that there was donations and, you know, grants, things like that. And so how do we continue to sustain the Emily Center from a resource and financial perspective in today's current economy and with things that are going on?
Sure, thanks for that. So the Emily Center did start as a fundraised donation space. They used to raise funds through, I believe, fashion shows and other charitable contributions. A few years back, the organization decided that the Emily Center was a needed necessity. We do receive donations for some of our programs. For example, the traveling book cart. We receive donations, as was mentioned in the presentation, from the community, but also one of our bigger funders is the Peter Piper, which is a Peter Piper Pizza, excuse me, Peter Piper Pizza organization here in Arizona that is a dedicated funder of our book cart. They generously donate money throughout the year to continue to allow us to buy books. Not only for the Emily Center, but again, for Child Life and for other areas in the hospital. We also are, as Brianna mentioned, we're looking for a funder through our foundation to support some of our mindfulness activities, our aromatherapy, our apps. So we have a great partnership with our foundation who brings in donors to tell them about our programs and our needs, and they're able to provide funds throughout the year to help support our many initiatives.
Thanks for that, Nicole. And then I do have a question for you, Nikki. Can you tell us just a little bit more about the Journey Board and the mobile apps? And like, for instance, how did they get their start? Like, where was the impetus to begin a program like that?
So for the mobile apps, it really started, we developed one with the diabetes team, and they received some money from a grant. And then from there, we realized what a great product it was. And we received then a grant from Cox Communications to develop our other handouts or our other journey boards into the free mobile apps. So started with one, and then as funding changed, sometimes we get, ketogenic diet ended up getting a grant. And so then we were able to support their journey board into a mobile app. So definitely started with Cox Communications, and we're super grateful for them and their donation. So
Nikki,
just
sorry, go ahead.
Sorry, go ahead.
Go ahead,
Nicole,
Jill.
go ahead.
I was
No,
going to say,
just
outside of Spanish, do we translate patient education handouts into other languages, and what is the most second popular language?
So we do have all of our handouts are in Spanish and English. Also, the mobile apps are as well. And then other handouts, we do have Burmese, Swahili, Vietnamese, and it really, I would say Arabic is another big one. So I'd probably say Arabic and Swahili are some of our more popular ones that we do translate to. And so that request would go through, we work closely with our language services team. And then once they're translated, then we make sure the families have the handout that they need.
Thanks, Nikki. Can you just staying on the journey board piece, can you tell us a little bit more about the fluidity of your education platform? Like, if you have the journey boards, how does that education flow from the teaching into the documentation? So there's documentation that this has all been done within the education record.
Thanks for that, Jill. So our education records are in our EMR. No more paper charting. We used to do that, but even our education records were still paper not too long ago. So what we did is we worked with our IT team to create a flow sheet that directly correlates with the journey board. So it's very specific. So the diabetes has their own education record, the tracheostomy has their own education record, etc. And so then each of those little journey board squares is kind of like what we say is a square or a box in the education record in the EMR. And so the staff can go right to those education records, check the boxes, is the teaching ongoing or is the learning complete? And then we have boxes about the tasks. So what tasks did we talk about today? And we've also worked with the medical team to determine what tasks are necessary for what we say is that safe discharge. And so prior to discharging these very complex patients, we go through and make sure all of the documentation is complete for those must-haves for safe discharge. And so again, it's very, very, very simple, very fluid. All the teach back points are already created. And so staff don't have to really think about, oh, what should I be asking them? It's already been defined and determined by the medical team. And so then that way it's, again, pretty simple to go from start to finish, making sure that the family really does know how to care for their child safely.
Wonderful. And then Brianna, we just got another question, and I think maybe you can address this one. It says, is the full collection of branded handouts and portal information available on the public site for patients to access from home and for community members to access directly?
No, it is not. The portal that we have is for internal use only at this time. Our public website has a Staywell product on there that they can go and find information there. And at one point we had our branded content on there. It's not currently there, but the goal is to bring that back.
Actually, can you want to elaborate a little bit more about the goals of some of the technical changes that we're going to be doing to the portal next year?
with the portal, we've submitted a request to have an upgrade, a facelift for the portal for the end user to have better searchability, but also to add it to the patient to-dos and get it to the families in that route through their patient portal as well.
What is a patient to do?
The patient to-dos are submitted to families through a text message or an email, however they prefer to be contacted, but it sends out ahead of an appointment their anything that they might need to fill out, anywhere from insurance information or consent forms, all goes through the patient to-dos. But the goal would be to have relevant information that needs to get to the families ahead of time to be allowed to be submitted through that and then also stored in their patient portal.
Thanks, Brianna. Joy, I'm going to direct this one to you. So this again is from Allison Caballero, and she says, how do patients get word, or patients, families, community get word that they can submit a request to you directly? How would they know that?
You're on mute,
You're
Joy.
muted.
That's a very good question. Thank you, Jill. We are very active in community events, and our reputation is well known in the state of Arizona through word of mouth, through other specialty organizations related to children, and not only just children in general, but children with special needs or children with a specific diagnosis. So our name is out there. We also solicit our services through our website, through Phoenix Children's website. So we're available there, and our contact information is there as well. And a lot of our community people out there, our specialty docs, our specialty clinics, share our information and our fact sheets with those. And we're real good about information that we provide regularly to make sure that our contact information on our fact sheet is submitted with everything that we offer, as well as a survey satisfaction. So that's important for us to get feedback on how we're doing.
Joy, you have an active presence on Twitter as well.
Yeah.
Yes, we have it. Thank you for that. We do have an active account on Twitter where we share our contact information and lots of community and consumer health information for families to learn more about specific diagnosis or how to care for their child, and safety information as well. So thank you. Yes.
And then I think one last quick question for you, Joy. How, we have a lot of really wonderfully constructed packets with very important diagnoses that are frequently seen, but we also have some that are unique that we don't see as often. But how is that decision made? Like, when is something going to become a packet?
Well, it's by demand. So if we see an influx of demand on a certain diagnosis, for an example, say one of our genetics clinics opens up a new clinic with a specialty diagnosis, then we would contact those clinical experts to see what their needs are, to let them know what resources we have and how we can help them, and create a packet of information using not only information sources from databases, but also including our patient education materials that our patient education nurse specialists create. So that's how they are compiled and separated into different categories, as I said before, using overview, treatments. If there's any specialty information they need to know about a diagnosis, that's included in there. Education about it, education information, and then resources and support information is in every single packet.
Thanks, Joy.
Mm-hmm.
Well, Nicole, we're nearing the end of our presentation. I don't know if you'd like to do the closing.
Sure. Thank you. First of all, thank you to this team. You guys did a phenomenal job sharing the information about the Emily Center and the fabulous work that we do here. I want to take an opportunity to thank HARC for hosting this conference and allowing us this opportunity to present this 90-minute panel. And we look forward to participating in the future if you ever ask again. So thank you. Cheers, everyone. Have a great day.
Bye.
Thank you.